Welcome to Open DXR. It's Tuesday on BronxNet. I'm your host, Kibin Alleyne, and I'd like to invite you to get social with us at BronxNet TV on Instagram and Twitter, and BronxNet Community Television on Facebook. New York City opened the nation's first overdose prevention center following CDC reports stating more than 90,000 overdose deaths occurred in the U.S. Over 2,000 deaths occurred in New York City alone. Joining me for discussion on the opioid epidemic is policy researcher for the RAND Corporation, Bryce Pardo. Bryce, thank you for joining me.
Thank you. Glad to be here.
So before we jump into it, can you give us a little bit of a little background about the research you're doing in regards to the opioid crisis?
Sure. So most of the research that we've been doing here at the RAND Corporation has focused on a couple different dimensions of this problem. One, how to respond to it, but also more importantly, what's been happening in recent years regarding the illicit supply of opioids in these markets, largely because of fentanyl encroaching in these illegal markets. We're seeing deaths rise at unprecedented historic rates. So the question then is, okay, what's changing in these markets, and then how to better respond to them. So that's been what we've been doing in the last few years here at RAND.
Now, we know that opioids are drugs, but for those who are not familiar, can you further explain what opioids are?
Sure. So opioids is a large category of substances that are used to treat pain primarily. These include things like oxycodone, or Oxycontin is the prescription brand name. Other opioids out there that are most commonly used in legal markets are heroin, and then now increasingly fentanyl. But fentanyl is a particularly interesting opioid because it's a synthetic opioid. It's not made from poppy, which heroin and oxycodone and many of the other opioids that we've kind of been using for hundreds of years have derived from poppy. Now that this is no longer being made from plants, it's made in a lab very quickly, very cheaply. And then in particular with the fentanyl series of opioids, they're very different. There are many different types of fentanyls, and some are extremely potent, orders of magnitude more potent than heroin. And so that's creating confusion in markets and really elevating the number of deaths we've been seeing in recent years because people aren't aware that they're consuming fentanyl. And so there's a lot of issues having to do with the emergence of fentanyl in the last few years. We've had a longstanding heroin problem in the United States for almost 100 years now. It's not something new to us, but really the fentanyl problem is what's driving these overdose death numbers up.
According to New York City Health, opioids were involved in 85% of overdose deaths in 2020. We've heard about this being a growing problem for years now, as you mentioned. Overdose deaths rates are higher and growing faster for some groups and places. Why have we been seeing this increase?
So as I said, this is largely has to do with a shift in the supply in recent years towards synthetic opioids like fentanyl, which are orders of magnitude more potent. So just to kind of give you a perspective, the average amount of what we're seeing in these counterfeit pills, these are made to look like prescription tablets, but they contain no oxycodone or no active ingredient that an individual is looking for. It contains maybe 2 milligrams of fentanyl. Well, 2 milligrams is about the amount of 2 grains of salt. And so when you're dosing in very small quantities like that, there's very little room for error. And so that's what's kind of contributing to the rise in overdose deaths, is that users and dealers don't really know what they're doing. And that problem when dosing there creates a lot of confusion and a lot of harms because people just aren't aware of these are markets that are not regulated. So that's what's contributing to this problem here. Prior to that, with heroin, you maybe needed 40 milligrams of heroin in order to elicit the same effect that maybe 1.5 to 2 milligrams of fentanyl would. So that's kind of what's largely contributing to rise in harms.
And has access in general become easier, you feel?
For fentanyl, yes, fentanyl has increased in these markets, but these are long-standing heroin and opiate markets. So these are places where people have long been accustomed to seeking diverted pills. And so that's one of the reasons why you have drug trafficking organizations or criminals that are basically pressing fake counterfeit tablets made to look like a diverted prescription medication. Or what they're doing is taking a little bit of fentanyl and mixing that with the heroin and selling that in retail markets. And so people think they're buying these longstanding opiates like heroin or oxycodone, diverted pills. Come to find out, that's not what they're buying. They're buying fentanyl and they're overdosing. So it's not really that the accessibility of opiates has increased. It's more just that the market has shifted towards, I guess, more accessible fentanyl. I mean, that is what's really more accessible now. The numbers of fentanyl in drug seizure data and in overdose death data has really shot up in the last 5-6 years. So that's what's happening. We've had kind of a long-standing, millions of Americans have an opioid use disorder. There's millions more probably in recovery. And so there's a lot of people there. There's a huge population of people who have become accustomed to using opiates, or they require it because they're physically dependent on it, chemically dependent on it. But then the market suddenly shifts towards a very powerful, potent alternative, and people aren't aware. And so that's what's kind of contributing to the rise in overdose deaths.
Now, in an effort to combat this, the city of New York opened the nation's first overdose prevention center. Mayor Bill de Blasio says overdose prevention centers are a safe and effective way to address the opioid crisis, but they are supervised consumption sites or facilities. What are
Mhm.
your thoughts on that?
So supervised consumption sites, this is, first for the United States. This hasn't been done before here, at least not officially. There have been a couple underground facilities. And I mean, fact of the matter is a lot of places where people do use drugs, they're somewhat supervised. A lot of people do use informally, they kind of have other people there, other drug users there. In other parts of the world, Canada, Europe, Australia, they've been using supervised consumption facilities where an individual goes into these facilities after buying powdered heroin or some other drug from the street market. They go to these facilities. They then use those drugs there under some sort of supervision so that in case an overdose does occur, someone is there to administer naloxone. But that these facilities do a lot more than just supervising use. They offer sterile injection equipment. They offer kind of basic psychosocial services, referrals to treatment, all other types of harm reduction interventions that are needed to really reverse some of these overdoses. So offering naloxone at cost or free to the individuals. So they do a lot more than just supervising consumption, at least outside of the United States, which we've studied. These are very novel harm reduction interventions, and so far the literature, by and large, has said that there's favorable outcomes here. Doesn't really solve the problem necessarily, but it can help to alleviate some of the risks or reduce some of the risks associated with overdose in these markets. Will it be a silver bullet? No, it probably won't be, but it will help some individuals kind of have access to other harm reduction services, or may be able to survive another day because their overdose was reversed.
Now, I know some critics have some opinions about this, and they
Mhm.
view it as an opportunity to create spaces that accommodate and magnify drug use. Have you found that to be true, or do you agree or feel like they have a valid reason for thinking that?
So that is generally the concern when opening up these facilities. In other countries where we've seen supervised consumption sites open up, the community, the business community, the religious community in those areas largely is very negative on their opening. But after a period of time, it really doesn't seem to bother them. There are benefits to moving some of that drug use out of public, kind of the common areas that passersby don't have to kind of step over people nodding out. You don't have to see discarded needles. So there are some benefits to some of these things. As the literature has generally shown that there's people that are able to get some basic services in these facilities. They discard their used needles there instead of discarding them on the street. They then are either supervised, and then after their use, they're then taken to kind of a cool down area where they're monitored in case they have an allergic reaction. So they're not nodding out in the street. So there are benefits to having these. And then again, after a few years of their opening, generally the business community kind of subsides. The pushback really subsides. There's no evidence to suggest this increases use. And in fact, I mean, you can make the argument that by removing public consumption from the kind of visible spaces, you're really taking that away from people's perception. I mean, you're no longer. I live here in DC, and I walk by a lot of people that are nodding out and kind of passed out on the street. So you're removing that kind of perception of people just kind of that drug use behavior in public spaces.
So, since we're talking about location a little bit, there's one in East Harlem that rests across the street from a school. Do you think people in this situation are right to have these concerns regarding the placement of this site just because it's across the street from children?
So, generally you would want to cite these things away from activities where children are living and engaging in school, of course. But is there already? I would first ask: is there already public drug use there? And then I would say, if there is, then you would really have to weigh the costs of seeing people strung out or passed out or nodding out in view of children, instead of where this happens kind of behind closed doors under some sort of medical supervision. Again, the literature doesn't shows that there is no increased use and consumption due to the opening of these sites. This isn't like a bar where people can kind of go and this isn't necessarily an attractive place to go. I'm guessing they're citing these near the school because there's already public consumption there, is my guess. If that's the case, again, you would need to weigh what the existing system is, or which is basically letting people use in public versus having them do so in a kind of closed door space away from public view.
That was a really great point. I never actually thought of like maybe there's already use there. So I'm really glad that you pointed that out.
I mean, typically that's the case in Canada where they're doing this. They're citing these where drug use is occurring, right? In public spaces like parks in the downtown east side in Vancouver, where there's a lot of drug use already. So it's not like they're just picking a spot. I mean, like, I don't know about the case in New York, but I would imagine they're doing this where it's already occurring.
All right. Now, how can people connect with you and stay educated on this topic?
Sure thing. You can look up our reports online at Rand Corporation, as well as connect personally to me on Twitter. My username right there. But all of our research is publicly available. We've done a lot on supervised consumption sites and other harm reduction interventions, as well as trying to understand how these markets are transitioning and to better respond to them. So please feel free to check it out.
All right, Bryce, thank you so much for joining me.
Thank you, Kibin.
We'll be right back with more Open BXRX Tuesday.